Good morning, everybody. Thank you so much, everyone, for being here. Thank you to this incredible coalition that is here to tell you about Senate Bill 1061. I'm Senator Monique Limón, the proud author of this bill. And I want to, again, just thank everyone for being here and tell you a little bit about SB 1061. SB 1061 requires medical debt is not included on consumer credit reports, saving millions of Californians from having their credit ruined. SB 1061 does not forgive debt, but it does ensure that when it's not reported, we don't negatively impact credit scores for a lifetime for people. We know that bad credit can lead to issues when securing a car loan, renting an apartment, or even getting a job. Credit reports are meant to gauge an individual's ability to repay future debt. However, medical debt is often unforeseen and life-saving. You're not always able to, it is not always a reliable indicator of financial risk. To add to this, multiple reports have shown that medical debt contains errors. And so many of us can relate to these errors. So many of us know what it's like to look at a medical bill and say, hold on, this hasn't been covered yet. I have to call my provider. I have to call the insurance. And we know that it's those moments that, if not addressed, can cause some of this to be an issue for many Californians, particularly if it is reported to credit agencies. When consumers dispute these errors, it can often take months, unfairly impacting their credit report. As our consumer, Sonia, will share with us today, this experience is common. It is an experience that many of us are familiar with. She received medical bills that were incorrect, that impacted her credit so severely that she had difficulty securing a home loan. Sonia is not alone. 23 million Americans, 23 million have medical debt. No one should have their line of credit ruined for accessing necessary medical care. SB 1061 is among the strongest legislation in our nation to protect consumers from ruining their credit and the impacts that this reporting has. It's so important that recently our Vice President, Kamala Harris, announced that the Consumer Financial Protection Bureau would move to prohibit medical bills from being included on credit reports. And we are very grateful for this effort. But this proposed rule does not include debt accumulated on medical credit cards or specialty loans. And SB 1061 fills that gap. Additionally, SB 1061 provides California consumers with relief starting in January, while the proposed federal rule remains under consideration. 7 states have passed laws that prohibit medical debt from appearing on credit reports. It is time for California to protect our consumers. I want to thank you all for being here, and I also want to invite Sonia, who I talked about, to come say a few words to you about why this bill and this issue is so important to her, to Californians, and to our country.
Thank you, Senator Limón, and thank you for letting me tell you about my experience with medical debt. In October 2021, I was involved in a major car accident while driving on I-80 from Sacramento to Oakland. The accident happened around 10 p.m. in the evening, and I was taken by ambulance to the ER in Fairfield. Luckily, I was okay, but they kept me there quite a while to run some tests and make sure everything was fine. As a state worker, I have full insurance coverage through work, so that was at least one less thing that I had to worry about. Fast forward a few years later to the summer of 2023, my partner and I made the decision to try and buy our first home. While applying for a loan, I was surprised to discover my credit score had gone down significantly due to an unpaid mystery bill. I called the credit company listed and discovered that the hospital I was taken to after the accident had correctly billed my insurance for everything except for one very expensive test that they had done. I thought it was a simple mistake. They had simply forgotten to add my insurance information to it and had billed me instead. But I somehow never received the bill. This was incredibly stressful at the time because my credit score negatively affected our mortgage rate at a time when rates were already at an all-time high. I've spent hours on the phone trying to get this fixed to no avail. Representatives at the insurance company have tried to help, as has the credit company. As of now, this is still showing on my credit score, and there appears to be not much I can do about it. Again, thank you for letting me speak in front of you today.
Thank you, Sonia, for sharing that story. I also want to invite Kathy Kennedy, the president of the California Nurses Association, who is one of the sponsors of this bill.
Good morning. My name is Kathy Kennedy. I'm a registered nurse and president of the California Nurses Association. CNA represents over 100,000 registered nurses across the state, and we are a proud sponsor of SB 1061. Our patients suffer when medical debt information is reported to credit bureaus. When Californians need care for a broken arm, they have a heart attack, have cancer, or toothache, they should never have to worry about seeing a doctor and getting medical treatment that would cause them to hurt their credit reports. As nurses, we see firsthand what happens when our patients fear that medical debt will ruin their credit. Too often, our patients delay or forego important medical treatment because they are worried about medical bills piling up. When patients skip care, the results can be catastrophic for their health. And this is especially true for people of color and working families who are more likely to have medical debt. Medical debt destructively limits access to credit for working families, making it harder for them to secure housing, transportation, and even jobs. And the problem is growing as high deductible plans and rates of medical debt continue to balloon. But medical debt simply does not belong on credit reports. Our patients' ability to pay for health care is not a reliable indicator of their credit worthiness. Even the credit reporting bureaus recognize this. By removing medical debt from credit reports, California can provide broader access to credit and lower barriers to health care for our patients and our working families across the state. Our patients should not be penalized for our credit system when they get the care that they need and deserve. We deeply thank Senator Limón, Attorney General Bonta's office, and our broad coalition of co-sponsors for their dedicated leadership to end this harmful practice. Thank you. Senator Limón?
Thank you so much to our California Nurses Association, who has been at the forefront of protecting patients, but also our consumers. Next, I want to invite an incredible organization, Health Access, that also has a history of really looking out for the issues of access and care. So I want to invite their leader here, Katie, to join us, please.
Good morning. I'm Katie Van Dynes, an advocate with Health Access California, and we're the statewide healthcare consumer advocacy coalition, and we are proud to be here as one of the co-sponsors of SB 1061. Healthcare is not a choice. When you're sick or in an emergency, you need care now. Yet, as healthcare costs grow at a rate that outpaces inflation, paying for our care is taking up more and more of our paychecks, putting 1 in 5 Californians in medical debt to a medical provider. Not only are healthcare costs growing, but so is how much you pay even before your insurance kicks in. When Californians seek care, nearly 80% of them have a deductible, and the median family deductible in California is nearly $4,000. That means someone is likely to incur debt for any healthcare service beyond a doctor's visit, like an emergency visit, a hospital stay, cancer treatment, a heart attack, an MRI, or even a broken bone. So while they're going through a stressful or scary medical situation, Californians must also figure out how to pay off this debt. And adding to those worries is worrying about what the impact will be on your credit score in your long-term financial experience and the impact on your credit. Those who already face barriers to care, such as people with low incomes and Black and Latino Californians, are more likely to experience this debt. And the impact of this debt is so well known that many people take it into consideration when deciding whether to seek care when they need it, and many opt not to, deciding just to steer clear of the bill, which puts their health at risk. With SB 1061 by Senator Limón, we can keep this medical debt off of credit reports, and Californians can put their health first. We urge the legislature to join 7 states who have already passed similar legislation and pass this critical consumer protection bill, and the governor to sign it when it's on his desk. Thank you.
Thank you, Katie. Thank you, Health Access. And another group that I've had the pleasure of working with for years related to the, what's important for consumers is our Consumer Federation. So I would like to invite Robert Harell to join us to say a few words.
Good morning, everybody. I'm Robert Harell. I'm the Executive Director of the Consumer Federation of California. We've been around since 1960 fighting for consumers. We're in mid-August. This is a critical time for the state legislature and the people of California. There are many, many important bills to be considered in the building behind me over the next 2 weeks. This bill, SB 1061, is one of the most important things that can critically and meaningfully help consumers in their real lives. As you've heard, this debt is not optional debt. People don't choose to get cancer or get hit by a car or break their leg. These are things that are foisted upon consumers, and they have to deal with them. And in the consumers that we talk to, many of them actually think that their credit score is some sort of governmental or quasi-governmental thing. It's not, but your score goes down 10, 20, 30, 40 points. It can have a dramatic impact on the kinds of products you're offered and the price point in which you're offered. The types of credit cards, how high the percentage rate is, it makes a dramatic difference. Whether you can buy a car, whether you can buy a home, as you heard from Sonia, it's critically important. A national consensus is beginning to emerge on this issue, and I want to thank Senator Limón, AG Bonta, and all the other wonderful co-sponsors of this measure. Together, we can fundamentally and meaningfully help consumers navigate so they don't have to make the Hobson's choice of, do I get care for my injury or illness, or do I keep my credit score at a decent level? Thank you very much.
And finally, I'd like to invite Jen Ingstrom from CalPERG, who is also here in support of the bill and knows that this issue is a very important one. Jen.
Thank you. Good morning. My name is Jen Ingstrom, and I'm the State Director for CalPERG, the Consumer Advocacy Group. With everyone here, we definitely want to thank Senator Limón as well as Attorney General Bonta and all the health and consumer groups that have been, just being champions on this issue and dedicated to helping Californians. As you've heard today, simply put, medical debt does not belong on credit reports. Healthcare costs in California have been rising faster than the national average and inflation, and now more than 1 in 5 Californians have medical debt. This alone results in financial distress for many, but on top of that, when that medical debt ends up on your credit report, that can even further compromise a family's financial stability by blocking access to mainstream credit, housing, and even some employment. And that's just not a fair credit system. Unlike other types of debt, medical expenses are not something you can control, and we have known for years that medical debt does not predict credit defaults. It doesn't accurately predict a person's desire and willingness to pay off a loan. And in fact, research from the Consumer Financial Protection Bureau shows that medical billing data on credit reports is less predictive than other types of traditional obligations. So that's why, simply put, we need Senate Bill 1061 to prohibit medical debt on consumer credit reports. We need a fair credit system that does not penalize people for things they can't control, like getting sick. So again, we want to thank Senator Limón, Attorney General Bonta, and everyone here today for working to solve this problem and help California families. Thank you so much.
Thank you, Jen. I want to thank everybody that is here, everyone that has spoken. Our Attorney General Bonta is not here, but he's also been part of this team that's been really pushing this and want to make it past the finish line. In our California legislature, today is a very big day. It is the suspense file gets released. And so we are here to show support for this and to move this bill forward. As folks might imagine, the closer we get to legislative deadlines, the harder the push in both directions to support this bill, but also for those that are opposing the bill. So we are here standing strong to get this to the finish line because we know that this is critical for consumers in our state and in our country. So thank you, and happy to take any questions. Thank you, everyone.